Hey everybody! Whether you are a longtime fan or new to the show, we are inviting you to have a re-listen to some of our classic episodes related to heart disease in honor of American Heart Month. Heart disease is the leading cause of death in the United States. It is the leading cause of death for both men and women and across all races and ages. It accounts for over 20% of deaths in the United States. Heart disease and stroke kill more people in the U.S. than cancer and accidental deaths combined. We are very passionate about heart disease and prevention in our practice and hope you can learn more from our podcast. Hey everybody, and welcome back to another episode of Hybrid Healing Hour. Today we are going to be discussing two common genetic risk factors for cardiovascular disease that you may never have heard of. It's familial hypercholesterolemia and Lp(a). We are welcoming back our very special guest, Dr. Seth Baum. Dr. Seth Baum is a preventive cardiologist, a past president of the American Society for Preventive Cardiology, and the chief scientific officer for Flourish Research. So welcome back. Thank you for coming again.
Well, thank you for having me again.
And before we dive into this, I wanted to kind of talk about cholesterol. As you can see, it's in familial hypercholesterolemia, which we also call FH, which I will be saying today because I cannot repeat that word several times. So I want to dive into cholesterol a little bit and how it is processed in the bodies, particularly the liver, because I think a lot of people assume and associate with cholesterol with what we eat.
That's a great question. So first of all, it's important to know cholesterol is incredibly important. Every cell in our body has cholesterol. Every cell needs cholesterol. And every cell can actually make cholesterol. Every single cell in our body can manufacture its own cholesterol. That's very important to understand at first. We do consume cholesterol as well. So cholesterol has two sources. One, we make it, and the other, we consume it. People also think that cholesterol just travels freely in the blood, but it turns out that cholesterol is a fat and the blood is aqueous, meaning water-based. And if you think about making salad dressing, water and oil don't really mix well together. You get little bubbles. So if that were to happen in the blood, if you had little bubbles of cholesterol or fat, it would be incompatible with life. We would die. So the body smartly has substances that will traffic cholesterol around the body. And these are called lipoprotein particles. And you've heard of some of them. Mm-hmm. You, of course, but I'm talking about patients have heard of some of them. You've heard of LDL, or low-density lipoprotein, and HDL, or high-density lipoprotein. There are a couple of others as well. The important thing to know is that these lipoprotein particles, these carriers of cholesterol that traffic cholesterol around the body, have different functions, different purposes in the body, but the cholesterol they carry is the same. So when people say, oh, my HDL is my good cholesterol, my LDL is my bad cholesterol, it's not true. Cholesterol is cholesterol is cholesterol. It's the carrier that has the beneficial or bad attributes. So what does this really mean? Well, the LDL, it turns out, low-density lipoprotein particles carry cholesterol solely to get the cholesterol out of the body. They're like garbage trucks. The more of these garbage trucks we have, the worse off we are, because they tend, imagine them as little circles, little spheres traveling around the bloodstream, and they interact with the blood vessel walls. They bang into the arterial walls. And the more of them there are, the more likely they will be to penetrate underneath the inner surface of the vessel and cause a plaque. And those are the plaques that lead to heart attacks and stroke and other diseases as well. So we want to keep those levels of LDL low. The liver, which makes cholesterol too, is also our friend when it comes to degrading or getting rid of the cholesterol. What the liver does is on all of the liver cells, there are these receptors, these little arms, if you will, little hands sticking out. And the receptors will bind the LDL particles, those little spheres that are the bad ones, right? Not the cholesterol being bad, but the sphere itself having bad attributes, and will bring the LDL particles internally into the cell where the LDL particle is degraded, and then the cholesterol is dumped out of the body, really ultimately through our GI tract. So that's what LDL, how LDL is being handled by the body. HDL, interestingly, is known as the good cholesterol because it helps take cholesterol out of blood vessel walls. It's very, very complex, though. We don't fully understand HDL, and all of our attempts to date to increase HDL as a means of decreasing heart attacks and strokes, all of those attempts have failed. So we can't, at this point, we can't increase HDL and cause a benefit. Similarly and related, a risk factor for heart disease is a low HDL. So a low HDL, particularly when identified earlier in life, is a risk factor for what's called premature heart disease, early heart disease. So just important to know as a potential warning that if you have a very low HDL or a low HDL, you may be at risk for early heart disease.
And I know we're not talking about just cholesterol today, but you kind of triggered a question I have. So I feel back in the day, a lot of, I heard medical providers say, oh, well, if your HDL is that high, then it overrides the LDL being high. And I'm like, no.
Yeah, and you're right. And a lot of people still say that.
Yeah.
It was so ingrained in our understanding and our literature that HDL could compensate for, high HDL could compensate for an elevated LDL, that it's hard to undo that. The reality is that's not true. There are even some genetically elevated HDL conditions that have a higher risk of cardiovascular disease. So HDL does not protect you. All of our focus with regard to cholesterol should, at this point, be on LDL. We also have triglycerides. We're learning more about them, but currently, LDL is the evil one. High LDL causes vascular disease. We used to call it the LDL hypothesis. It's not. We have study after study after study that demonstrate the same thing. High LDL causes vascular disease, causes heart attack, causes stroke, causes peripheral arterial disease. Reducing LDL decreases the risk of those events.
And you also explained something very well that we hear a lot from patients and from things they read online, that cholesterol is necessary. You need cholesterol for life. We're not talking about lowering cholesterol. We're talking about lowering cholesterol transport molecules.
Correct. We're talking, well, ultimately you will lower cholesterol, but what we're not talking about is eliminating the capacity of a given organ to make the cholesterol it needs. And the most important one that people refer to is the brain, because the brain requires so much cholesterol. And so I hear this all the time, well, if my LDL is super low, my brain's not going to get nourished in cholesterol. Couple of things about that. Number one, LDL does not supply cholesterol to any tissue in the body, so it doesn't do that. Number two, even if it did do that, LDL can't cross the blood-brain barrier. So we have a barrier that separates the systemic blood, the blood in our body, from the blood in our brain, and that barrier is important because it protects the brain. LDL can't cross it, doesn't make it across. The only time it makes it across is in elderly patients when the blood-brain barrier starts to be less functional, and that's a bad thing when they cross. The other thing is the brain avidly can manufacture its own cholesterol. It does not need any outside source of cholesterol. So your cholesterol, your LDL could be zero, and your brain is just fine.
I'm really glad you touched on that, because we do a lot of more functional medicine in our office too, and holistic, and that's something that a lot of people are terrified to start statins or to go too low with their LDL, and we know you're born with an LDL of about 20 when you're right, and is there anything wrong with getting it down that low?
There is nothing wrong, and if you think what is the most important thing that happens early in life during both the fetal period and the first 2+ years of life, it's brain development, it's neural development. That's what the baby's doing. It's growing its brain. It's growing its peripheral nervous system as well. So if we're born with an LDL as low as 20 or 30. It would make absolutely no sense, biologically and from an evolutionary standpoint, for cholesterol to be a requirement for brain growth. So it really makes no sense. I understand why people say what they say, why people are afraid, but it really makes no plausible physiologic sense to worry about reducing LDL cholesterol and causing a problem with the brain. And we've looked at this in a number of studies, in giant studies, where we've looked at thousands of patients with LDLs as under 25 even, and there's no signal of harm for brain issues, cognitive issues, nothing.
So now that we've talked about no harm in low cholesterol, let's jump to one of our genetic conditions, familial hypercholesterolemia with high LDL. Can you explain to our audience what FH is?
Yeah, sure. First, I'm going to put in a plug here for the Family Heart Foundation. Oh. So, because we're about to discuss FH and Lp(a). And the Family Heart Foundation is a foundation that was started over 10 years ago and addresses these two genetic issues in a very effective way.